Hi, my name is Bonnie Ragulia. I am a physical therapist, an educator, and a student. Currently, I am enrolled in the Education 730 Issues and Trends in Learning Technologies course at Liberty University. For this course, I have created the video titled Assistive Devices. This video is tailored for novice physical therapists and student physical therapists. However, this video may be helpful beyond the realm of physical therapy. For this video, I have four main objectives. Objective 1 is to define the term assistive device. Objective 2 is to recognize common assistive devices. Objective 3 is to understand why an assistive device may be necessary. Objective 4 is to recognize anatomical landmarks for proper fitting of common assistive devices. For Objective 1, we're first going to define an assistive device. It's a piece of equipment, such as a crutch or cane or walker, that is used to provide support or stability for a patient when he or she is walking. There are different categories of assistive devices. As you can see, we have 5 images, and they fall into the categories. So as you're looking at image A, that is a walker. Image B are bilateral axillary crutches. Image C is a quad cane. Image D is a hemi-walker or a hemi-cane. Image E is a straight cane or a single point cane. There are different reasons why a patient may require an assistive device. These reasons may include compensating for impaired balance, decreased strength, an alteration in coordinated movements, pain during weight bearing on one or both lower extremities, an absence of the lower extremity, or altered stability. A patient may require an assistive device to improve functional mobility, enhance body functions, as well as assist with the healing process. The next part of the video is going to be the confirmation of fit process. To perform the confirmation of fit, I'm going to be using anatomical landmarks, or landmarks that are on the human body, to be able to help confirm proper fitting. For a common device such as our front-wheeled walker, I am able to position the walker with the posterior leg of the walker at my midfoot. From there, I'm going to assume my normal posture. And I want to be able to look for 3 landmarks. The first is going to be on the lateral portion of my leg. It's a bony landmark that I can feel or palpate, and it's called the greater trochanter. It's an attachment site for muscles. And so I want to have my walker aligned with the greater trochanter. The second is going to be my wrist crease. There's a little bony landmark that's called your ulnar styloid process. And so with my arm at my side with good posture, I want to see if it is going to align with the ulnar styloid process. And third is going to be really the most important. I want to make sure that my arm is comfortably resting with a slight bend in my elbow of about 20 to 25 degrees. That will be ideal for being able to advance the walker. And so as I'm looking at the 3 landmarks, this device is properly fit. As I'm going on to the next, this will be my quad cane. This is a narrow base quad cane. And as I'm looking at the landmarks, I can position this slightly lateral and anterior to my forefoot and go through the same 3 landmarks, the greater trochanter, the ulnar styloid, and then having a bend or elbow flexion of 20 to 25 degrees. Very similar to my quad cane are going to be the axillary crutches, because I can place them just slightly anteriorly and laterally for a 45-degree angle. From here, I want to see those same 3 landmarks. So I'm going to let my arms rest, and I can do one at a time. And I will be able to see the ulnar styloid process, the greater trochanter, and then I'm able to look and see, do I have that nice elbow bend? Additionally, I want to make sure that I'm not having compression underneath of my axilla or my armpit. And so I should be able to place about 2 to 3 fingers underneath of my armpit before I get to the crutch.
The next few slides are going to further illustrate the need for confirmation of fit of an assistive device. And so through the process that we just described in our video, you can see on the right-handed image that the rolling walker or the front-wheeled walker is going to be fitted correctly. There's going to be alignment of the posterior leg of the walker with the midfoot. If I had my arm relaxed, it would align with my ulnar styloid process. You can see that it is at the region of my greater trochanter. And with my arms resting, I am able to have a 20 to 25 degree bend in my elbow. The image on the left is going to be an improper fit. When you're looking at the image on the right of a proper fit for axillary crutches, you can see that they're placed at about a 45-degree angle, that I have upright proper posture, and that the hand grip is going to align with my greater trochanter. If my arm was at my side resting, it would also be aligned with my ulnar styloid process. When my arms are placed on the device, I am able to have a 20 to 25 degree bend in my elbow. And further, if you were to assess under the axillary region or the armpit region, you would be able to have enough to fit 2 to 3 finger widths. So that is avoiding axillary compression and compression of very important vessels and structures. Finally, the image here with the quad cane, you can see on the right the proper fit. The quad cane is placed and the arm is resting with a nice elbow bend, and the quad cane would align with the landmarks of the greater trochanter as well as the ulnar styloid process. So hopefully those will further illustrate the need for confirmation of fit, but if you have any additional questions, don't hesitate to reach out. My email is included on this screen. And also, I just wanted to, in our conclusion, share the reference that I've been using, which is the 6th edition of the Pearson and Fairchild's Principles and Techniques of Patient Care. Thank you so much.